Hello and good evening, all the doctors. A warm welcome to all of you on this microbiology live session of the 25 most important questions that we are expecting. So basically, when we refer to 25 most important questions, I hope you all understand we are referring to these topics, right? That means on these topics, you can expect the questions to come. Now, I have one request for you all. Like, after you finish watching this video and before you go to your exam, I want you to watch even my previous video on the 25 most important questions. So combine these two, like watch both the videos, and then you will cover a lot more topics if you cover the earlier video as well. All right, so that's my request to all of you. If you do that, that's going to be really beneficial for all of you. Some topics which I might not cover today, they would be covered in the previous video. All right, so apart from this, hope your spirits are all positive, and with whatever the tension pressure that we have right now, we will definitely get through this exam and we will pass out with all the flying colors. All right, so what we are going to do is, whenever I read out one question, I'm going to spare like few seconds where you guys should answer the question first, and following which we will have the discussion of these questions. All right, so let's start with our very first question. So this is our first question. Identify the disease caused by the parasite that is shown in this image. All right, so you have to identify this parasite first of all, and I know from our classes you guys will answer this very easily. Now the diseases are mentioned there. Pick out one answer from this. So I'm waiting for your responses. What is the disease caused by this parasite? Also, if possible, type out the name of this parasite, please. All right, so I'm looking at your options right now. So I can see majority of the people are answering this correctly. I'm so proud of all of you. So chalo, let us discuss this. First of all, dear friends, this parasite that is being shown here is nothing but the Giardia lamblia, as we all recognize this, right? This is the Giardia. I've told you this is nothing but the trophozoite of this Giardia. The infective stage of the diarrheal agents is generally the cyst. For Entamoeba histolytica and Giardia, the cyst is described like this. It's going to have 4 nuclei, so it's described as quadranucleate cyst. So quadranucleate cyst is ingested by fecal-oral route. Okay, now this dude comes inside our body, and then, right, it is going to cause the diarrhea with steatorrhea. The correct option for this is diarrhea with steatorrhea, as you guys have marked this correctly. All right, if it was Entamoeba histolytica, then the first option would have been correct. First option is dysentery, meaning a bloody diarrhea. The bloody diarrhea, doctors, was with Entamoeba histolytica, the one we have learned with that inverted flask shape ulcer, which fills up, right, with this pus, which is compared to a sauce called as anchovy sauce, right? So that was Entamoeba histolytica. Second option is very clearly describing the Giardia lamblia, the one that shows this falling leaf motility, right? And then the option D, delta, is going to be Naegleria fowleri. This disease is called as primary amoebic meningoencephalitis. Generally, they will mention the history of swimming in fresh water, following which somebody may acquire this infection. So that's about the option D. Now, coming to the option C, I'm deliberately discussing this in the end. The reason is because when you look at this trophozoite, many of the people will think it might be trichomonas also, right? The one that causes strawberry cervix. But guys, what I had told you during my classes is the way you should recognize this Giardia, it has this very particular human-like face, If you pay attention to this appearance, it looks like it's having eyes, it's having nose, and it's smiling right at you, right? So this is your flirty parasite that is known as Giardia, right? So that's it. This is the correct option for this question, right? So good job on whoever answered this correctly, right? Now, moving on to the second question, dear friends. So this is your second question. The parasite showing the egg in the image below is related to which condition? All right. So again, the question is based on the eggs. There is a picture of an egg given over here, and they're simply asking you, right? What is the disease caused by this parasite? Basically, you have to identify the egg and see which parasite does it belong to, right? And then you will be answering what disease is this. Alrighty, majority of you are answering correctly. Again, good job on this. You guys look already prepared from microbiology. All right, now the correct answer to this one, this is going to be perianal itching, doctors. Okay, the correct answer to this is perianal itching. So first of all, you should recognize whose egg is this, doctors. This egg belonged to this parasite who we call by the name of Enterobius vermicularis. Okay, the parasite is called as Enterobius vermicularis. All right, how do you recognize the egg of this Enterobius vermicularis? See, generally it is described to have this division like this. Do you see these lines in between? You should be looking at these lines that divides it, and the larvae that are developing inside this, they are described as tadpole shaped larva. Tadpole shaped larva. Now I'm going to discuss the eggs of the parasite coming up shortly, but until then I just want you to look at the other options also. Option number A, right? Iron deficiency anemia. It is caused by hookworms, right? Iron deficiency anemia is by hookworms, namely Ancylostoma and the Necator. They are going to cause the iron deficiency anemia. Megaloblastic anemia, if you talk about the parasites, there is fish tapeworm known as D. latum, right? Diphyllobothrium latum. Rectal prolapse is by Trichuris. I saw some of you have picked up even the option C. Guys, Trichuris egg you have to identify. That's why what I have done is, the next part, we are just going to look at these eggs first of all, right? Let us become familiar with all these eggs. Okay. Now, I really want you to understand here. This egg, what you're looking at is Enterobius vermicularis. Okay. Enterobius vermicularis. This is the egg here. All right. And this is showing that tadpole shaped larva. Roughly, if you look at a shape here, you will be able to appreciate that that is nothing but tadpole shaped larva. That is Enterobius vermicularis. Okay. Now, this is the barrel shaped egg. This one is barrel shaped egg. This is seen with Trichuris. And guys, you should remember the Trichuris is the one that is going to cause the rectal prolapse. Okay. Trichuris is the one that is going to cause rectal prolapse. Is that understood? And then these eggs, what I'm showing you, they belong to this worm called as Ascaris. All right. So these eggs, what you're looking at, these are the eggs of this worm by the name of Ascaris. So if you see this barrel or dumbbell shaped eggs, roughly if you draw, right, this looks like this. This is the dumbbell shape that you're able to see here. These are nothing but the mucus plugs in the end that you see in this eggs. All right. And this is the very easy identification of Trichuris. Trichuris causes that, rectal prolapse. It's a whipworm. Ascaris eggs are shown here, right? And then you see this egg that has this tadpole shaped larva. That is what is described as that is Enterobius vermicularis, that was shown in our question, right? So that's about that. Okay, next let us have a look at the other eggs also. Let us learn these ones. So first of all, guys, why don't you participate and tell me this? Whose egg am I looking at when I'm showing you this three pairs of hooklets here? Whose egg am I showing you with three pairs of hooklets? So if you saw the three pair of hooklets, right? If you saw this three pairs of hooklets, you all know this is nothing but the egg of a cestode, right? This is the egg of a cestode, or what we call as a tapeworm, right? This is the egg of a cestode or a tapeworm. Next, this is described as a operculated egg because it has this opening on top, right? This operculated egg is an egg of trematode, and you know the trematodes are also called as flukes, right? So trematodes are basically called as flukes. So these are the identifications that you have to know. Cestode egg has that three pairs of hooklets. Trematodes basically has this thing over here, that is the operculated egg. Now, one trematode called as schistosoma is an exception. Schistosoma is an exception. So it does not have operculum. So these three eggs, what I'm showing you on this side, they are basically the eggs of the schistosoma. Schistosoma does not have this thing. So have a look here. How do you recognize the eggs of schistosoma? Instead of having that opening over there, they rather have spine or knob, right? They're going to have spine or knob. Based on the location of the spine, we categorize the species of schistosoma. So if you see the spine on the lateral side, this is known as schistosoma mansoni, right? This would be described as schistosoma mansoni. Is that understood, guys? This is mansoni. Next, another one, if you see the knob like this, the small knob what is seen here, this is known as japonicum. This is known as japonicum over here. And then lastly, dear doctors, if you see the spine at the ending called as terminal ending, this terminal spine is a feature of hematobium, right? This one called as hematobium. So schistosoma hematobium we have studied. It is the one that is associated with bladder cancer. Bladder cancer. So guys, just a easy recap. Let us say that cestodes are the tapeworms. Tapeworms has this egg which is described to have that three pairs of hooklets. Trematodes, if you talk about the trematodes have that opening which is called as operculum. So operculated egg is a feature of trematodes or flukes. Which is the trematode or fluke that does not have the operculum? Schistosoma. So that exception, you are seeing right here on the other end. And then this egg, what you're seeing here, this is the egg of the hookworms, the one that causes iron deficiency anemia. Hookworms, ancylostoma or the necator. This is the egg. It looks like this. So basically it's made up of these things which are called as blastomeres. There are four blastomeres what you see in the egg of this hookworm, right? So that's about that. These are the eggs that you should be completely familiar with. All right, we know majority of this eggs by heart. You guys are doing very well on this. All right, so that is the idea right here, doctor. Okay, so let us move to our next one now. Okay, next question. So here you are, guys. Go ahead. A 25-year-old male presents with vomiting 5 hours after the consumption of bakery items and custard. Which is the most common organism implicated in causing this food poisoning? All right. The correct answer to this is Staphylococcus aureus. Okay. The correct answer to this question is Staphylococcus aureus. Now, first of all, what tells me this could be Staph aureus, right? First, the incubation period itself. If you look at the incubation period, it is less than 6 hours. So, guys, if you are seeing something less than 6 hours, that means it's the fastest food poisoning. And we have mentioned the fastest food poisoning, it is seen with two organisms, aureus and cereus. Aureus and cereus, they are going to present with fastest food poisoning. So now the question arises, why is this not Bacillus cereus as the answer? That could also have been the option. If they want to ask you Bacillus cereus, they would have mentioned Chinese fast food. If they had mentioned Chinese fast food, then we would have chosen the answer as Bacillus cereus. Because they have mentioned things like bakery items, custard, etc., even processed meats for that matter, right? It is Staph aureus. Because of the food, we have all chosen this, right? Staph aureus. Now, it's a preformed toxin. It's a heat stable toxin, meaning despite heating the food, the toxin will not get destabilized, right? And vomiting is the predominant feature because this toxin is going to have that vagomimetic effect. Also, diarrhea can happen, but this is the predominant feature, vomiting. Exact same things are, copied by Bacillus cereus, except for the fact the food is going to be different. Chinese fast food. If you consume this food and they ask you food poisoning, you will choose this. Clostridium botulinum, please remember, botulinum se bottle you have to remember, right? Bottled or canned foods, home canned foods especially, they are the ones associated with Clostridium botulinum. And one very important feature you should remember, this is the only food poisoning that we know of which produces constipation, right? So Clostridium botulinum produces constipation. So this is the idea. And it happens because of the mechanism of the toxin. The Botox, basically what you learn in pharmacology as well, right? Botox relaxes muscles. What exactly is Botox? Botox is nothing but botulinum toxin. So the idea is this relaxes your GIT muscles also. And if they don't undergo peristalsis, you cannot expect a defecation. Rather, it's going to lead to constipation because the GIT muscles are getting relaxed. So that's why with this botulinum, you can expect constipation. Now, Clostridium perfringens, we have said this is associated with some meats, right? Consumption of meat can lead to this presentation. So what I'm going to do right now is just give you an outline. If the incubation period is less than 6 hours, that means the fastest food poisonings, then you should remember either the aureus or cereus. All right, aureus or the cereus. All right. Now, even in my class, I tell you this. Generally, when we talk about this fast cars, etc., the movie that come into our mind is Fast and Furious. Fast and Furious, right? So with the fast word, we all relate this word Fast and Furious. So I'm just asking you to do something. Just like that movie Fast and Furious, we will say aureus and cereus. Instead of, right, Fast and Furious, we know it as aureus and cereus. These are the fastest food poisoning in onset, incubation period being less than 6 hours or so. Okay. Now, let's say if the incubation period is between 8 to 16 hours, right? If the incubation period is between 8 to 16 hours, right, somewhere in between, then you have this dudes called as perfringens, and then even Bacillus cereus. Bacillus cereus. Now I know some of us must be thinking, sir, you just said this guy comes under less than 6 hours. How come it's coming under 16 hours also? So guys, please remember the point is Bacillus cereus is good at mimicking others. It copies others, right? If it copies aureus, then it's going to be fast. If it copies perfringens, then it's going to be slow, 8 to 16. So cereus copies others seriously. That's how I remember. Cereus copies others seriously. All right. and then remaining everybody else is going to be more than 16 hours incubation. Example, Vibrio cholera, right? E. coli, etc., etc., Campylobacter. All of these guys, they are going to be quite slow in onset. Is that clear to all of you? Exam generally goes for the first two. That's why I want you to make sure you all know this. The fastest food poisonings are aureus and the serious. All right. So that's about that. Let us go ahead to the next question. Here you go, doctors. A person presents with complaints of dark urine. Sample is shown below. The organism related with this condition is also associated with all the other diseases except. So it's a sample of the urine. So first of all, you should identify what disease is this, who's the causative agent, and then you should know what are the other diseases caused by the same organism. Please read the question properly. They are asking you except, which is not the disease by that organism. That is the question. All right, dear friends. Looks like you guys are doing great as usual. Let me just address this topic now. Okay, so what you're seeing here is the cola colored urine or cocoa colored urine, which is a feature of PSGN or acute glomerulonephritis. Right, you all know glomerulonephritis, nephritic syndromes presents with hematuria. So this is that condition. I hope you're all clear on this. This is nothing but PSGN. What is full form of PSGN? Post streptococcal glomerulonephritis. That means it's after some kind of a streptococcal infection. Who is this streptococcus causing this? The answer is group A streptococci. The answer is group A streptococci, who we also call by the name of Streptococcus pyogenes, right? This guy is Streptococcus pyogenes. So technically, scarlet fever with that strawberry tongue is caused by pyogenes. This is a disease caused by that guy. So this cannot be the correct answer. Rheumatic fever, of course, this is also caused by group A strep. Pharyngitis is the history of that rheumatic fever, that is also there. But the disease that is not caused by this guy is botryomycosis. Botryomycosis is a mycetoma-like disease which is caused by the superstar called as Staph aureus. Staph aureus is that causative agent that is going to cause botryomycosis. So this is your correct answer, guys. Okay. So what I'm going to do right now is just throw some light on the basics that you have to remember with this dude. So group A streptococci, right? They basically cause this infections called as pharyngitis. Okay, they cause pharyngitis, which is nothing but sore throat. Or they can cause some infections called as skin infections or soft tissue infections. Okay, they can cause some skin or soft tissue infections. So this is what you have to remember. These are the basic diseases. Now what can happen is these diseases, what you're seeing here, they may get complicated, right? In some, dangerous diseases. Examples of these diseases which they may get complicated as, one of them is rheumatic fever, and second one is PSGN or acute glomerulonephritis. All right. And this is the examples of the hypersensitivities. If it is rheumatic fever, it's a type 2 hypersensitivity. And if it is PSGN, it's a type 3 hypersensitivity reaction. Right? So this is what that you have to remember here. In the rheumatic fever, this is the topic where you study about the Jones criteria, the ASO titers, right? So that's about this topic here. All right, doctors. So let us move ahead to the next question now. A 15-year-old female presents with fever. Oral exam shows a massive tonsillar swelling and a dirty gray membrane. Gram stain showed gram-positive bacilli. What is the best method for the isolation of this bacteria? All right, so let's get to the answer for this. First of all, you have seen this dirty gray membrane picture 1,000 times in the classroom, and I'm sure everyone who's studying right now have seen this dirty gray membrane picture. Okay, so please understand they're talking about diphtheria right now. All right, they're talking about the diphtheria. What is one more hint that is telling you that? Gram-positive bacilli. Please read the question properly because it's like a massive mistake majority of the students have made right now. They have given the option as alpha A, Loeffler serum slope. That is the wrong answer. Please see what the question was asking you. They were asking you best method. Best method for the isolation. I have repeated this so many times in the classroom. It is potassium tellurite agar. Potassium tellurite agar, this is the best one that you have to remember. The correct option for this is PTA. It forms black color colonies on this PTA, right? Now, the people who have given the Loeffler serum slope as the answer, see, this is also used in diphtheria. You should have answered that if they had, if they would have asked you, what is the rapid method for the identification? Rapid method is Loeffler serum slope. You can see the growth within 6 to 8 hours, right? On the LSS, you're going to expect the growth within 6 to 8 hours. Whereas on the PTA, the growth is expected in 2 days, 48 hours. So at least if you remember the 8 and 8, basically one is 8, another is 48. Yes, it is slow, but it is good for the isolation. Potassium tellurite agar, it's good for the isolation. Reason being, Loeffler serum slope contains serum, and serum when you add, it's a enriched media. It is a enriched medium. Enriched medium will allow the growth of certain commensals. So it's not the best for identification of only diphtheria because you can expect contamination here. It's an enriched media. Whereas PTA will only allow this guy to grow called as diphtheria without any commensals. That's why the best for the growth is PTA. Is that understood, guys? Don't make that mistake now. It's okay if you make it here. Learn it if this is asked in exam. Best if they ask, PTA is the answer. Rapid if they ask, LSS is the answer for this. Loeffler serum slope. Right? So everything in and out about diphtheria you guys should revise. For example, that Chinese letter appearance, that special metachromatic granules or volutin granules stained by Albert stain most commonly, but there are some other stains also like Ponders and Neisser. I repeat, for the metachromatic granule, Albert, Neisser, Ponder. These are all the 3 stains used for those granules. All right, please memorize the ELEX test. ELEX test is for the toxin of the diphtheria. All right, so everything about diphtheria is very high yield, guys. You cannot escape this guy. Okay, so this is nothing but that, membrane that you talk about. All right, this is described as the pseudo membrane of diphtheria. Right, next, going further, this is your next question. A businessman from Canada had stayed in India for 3 months, okay, to set up his business. Now, during his stay, he had developed fever, chills, sweating, etc. He visited a clinic, and on physical exam, the doctor noticed hepatosplenomegaly. Now, the blood samples were sent to the lab for microscopic exam, release of which form of the organism causes the paroxysms of fever. Simple question. Diagnosis is quite simple. Whether you remember or not the infective stages, that is what is the deal. Okay, infective stages. Then, what is responsible for causing the symptoms of this disease? That's what's asked here. So, guys, let us talk about this one now. First of all, they're talking about the disease called as malaria here, right? Malaria disease. You all know malaria disease, it's basically there are two hosts that are involved here. All right, one is a definitive host. Definitive means the parasite in which the sexual cycle takes place, right? Sexual cycle of the parasite takes place, that is known as definitive host. And who is the definitive host here? Female Anopheles mosquito, right? Female Anopheles mosquito. So how does this mosquito get affected in the first place? Not every mosquito is having malaria agent, right? So mosquito itself first should get affected, then it can spread it to human beings. So you should all remember the infective stage to the mosquito is known as gametocide. All right, the infective stage to the mosquito is known by the name of gametocide. Is that understood? And same way, who is the intermediate host here? Intermediate means the asexual cycle takes place. This host is human beings, right? So man is nothing but the intermediate host. And to human beings, the infective stage by mosquito bite is sporozoite. Sporozoite is the infective stage to the human beings right now. Now, the question is not asking infective stage here. They are asking you the symptoms of malaria, what you get is because of which stage. Now, let me just first address the answer for this, then I will come here. The correct answer to this is going to be merozoites. Okay, the correct option here is merozoites. So guys, let us just recall one simple thing. When these guys are inside our blood vessels, right? When these agents are inside our blood, let's say this is our RBCs. Now, when this guy is inside our RBCs, what happens is they're forming multiple things called as merozoites. Merozoites. As you see, there is a limited amount of space present inside the RBCs. So at one point of time, this RBC is going to rupture. Once this rupture, all these merozoites will get released into the blood. These merozoites are going to get released into the blood. And once this happens, this is going to lead to that fever. And once this new merozoites have come inside the blood, now they will go affect the next RBC. The cycle keeps continuing like this. So how long does it take for these guys to rupture the RBC? That is important because that correlates to the cycle of this parasite and leading to that specific patterns of the fever. So just reminding you one thing, what are the two commonest species that we see in India? Vivax and falciparum. Vivax and falciparum. Falciparum is severe and Vivax is comparatively milder. Now, the good thing is both of them has the same amount, same duration of cycle in the RBCs. That is 48 hours. 48 hours means how much time? 2 days. So every 2 days they are rupturing the RBCs. That means as soon as the second day finishes, the third day starts. That's why the fever will come now on the third day, known as tertian fever. What is the name for this malaria? Tertian fever if it is caused by Vivax or this guy called as falciparum, because these are the ones in India. I'm just teaching you these two right now, Vivax and falciparum. There's one more, Plasmodium malariae, whose fever comes every fourth day. That's why it's called as cotton fever. And why does the fever come fourth day? Because the cycle is for the 3 days. Once the cycle finishes in 3 days, the fever comes on the fourth day. That's how it is. So this is what the question has asked you. When does the fever come? The symptoms. It's due to the rupture of RBCs, which releases massive amounts of this merozoites into the blood, right? And this keeps continuing. This is why you should expect anemia in the malaria, right? They're damaging your RBCs, which is going to lead to malaria. So that is the idea here. Okay. Now, next, let us just quickly run through these things that you all know about anyway. See guys, you all know falciparum is the severe form of malaria, right? Falciparum is the severe form of malaria. So what I will be doing here is, I will ask you to remember this by this Hindi word called as Bimar, right? What does the word Bimar means? Bimar means sick, right? So you should remember Bimar word means sick, right? Is that understood? So who makes you more sick in malaria? Falciparum. So these are the features of falciparum I'm teaching you right now by this word called as Bimar. So what is Bimar? First one is this banana shaped, right? This is nothing but banana or crescent shaped gametocytes. So you're looking at this one right now. This is the banana shaped gametocyte. A very easy identification of falciparum. Next one, if you look here, you see some dots in here because they produce vacuolations in the RBC. These are called as Maurer dots, right? Maurer dots. Next, please remember, they produce these forms called as acol forms, which basically look like headphones, right? They look like headphones like this. For example, if you imagine this like this, they are going to appear somewhat like this. This is known as the acol forms, right? If you look at the RBCs, you will tend to see those also, right? Those are described as the acol forms. Next, A for all age RBCs are affected by falciparum. It doesn't spare anybody, right? No racism. Young RBC, old RBC, whoever it is, everybody is affected by this guy, right? Vivax affects mainly the young RBCs, whereas this guy called as falciparum affects all age RBCs, young or old, right? Last word is this resistance to the drugs is seen by this, which is called as recrudescence. Okay, recrudescence. This is the word over here, recrudescence. So that's it, guys. This is all that you all understand by this word called as Bimar. Bimar. Okay. Now, how do you differentiate Vivax or falciparum by looking into the RBC? You have to look at this trophozoite stage which is present inside the RBC. See, I know, don't get confused. Merozoites are getting made inside RBCs, I agree. But there is one stage in between called as trophozoite also inside the RBC. And that trophozoite can give you this ring forms. If you see multiple rings within one single RBC, that's where you should remember it is falciparum. Multiple rings within one RBC. So that is another M I'm going to teach you right now. Apart from this, you should remember this multiple rings. Multiple rings within one RBC is a feature of which guy? Falciparum. Single ring within one RBC is a feature of Vivax. That's the identification. All right. Now I know when you're looking at this picture, some of you might be thinking, "Arey bhai, ye kya ho gaya? Who is this dude? I have not seen this picture." Maybe you did. You remember this. So guys, this appearance, what I'm showing you right now, it looks like this X. It's a cross, right? It's a cross. It is described as Maltese cross appearance. Maltese cross appearance. Please remember this Maltese cross appearance. It is by one parasite called as Babesia. Babesia is that parasite that causes malaria-like disease, right? You should remember this Maltese cross is seen in Babesia, which causes this Maltese cross appearance. Okay. But the only difference is malaria is spread by mosquitoes, whereas this is spread by one tick bite called as Ixodes. Babesia is spread by this tick called as Ixodes tick. So that is the thing that you all should be remembering here. All right. Make sure with malaria, you guys know what is the prophylaxis drug of choice, what is the management, that you have to do in the northeastern states of India versus the rest of the India, right? See, doxycycline and mefloquine, these are the drugs that you have to know for the prophylaxis that we have covered in the class already, right? Make sure you know that. Severe infection, IV artesunate is given. Cerebral malaria, etc. If you get the severe form, then you have to give IV form, IV artesunate, right? So that's about that, guys. Let us move to our next question, right? Quite easy. So the question is, a farmer who works for a leather factory presented to the dermatology clinic with lesion having black eschar over the forearm. Right? On further inquiry, he informed he regularly handles cow's skin. Obviously, he is in the leather industry, so leather is made from the skin. Correct statement related to that organism is? Okay, that is the question. All right, guys. Now, this organism that we are talking about here, this guy is known as anthrax. This guy is known as anthrax. Is that understood by all of you? Now, anthrax causes two types of diseases we have learned. One is called as Hyde-Porter's disease, which is described in this scenario right now. Hyde-Porter's means somebody transporting skins of animals can get this, right? And another is the fatal form called as Wool-Sorter's disease, that is due to inhalation of spores. That's due to that. Okay, simply put, now they're asking you anthrax related, statement. Which one is related to anthrax here? So I'm going to just write these things down, then I'm going to explain this one by one to you all. Okay. All right, guys. So have a look at this now. What I was telling you is this, right? They have mentioned the keywords like leather factory, black eschar, coming in contact with the skin of animals. This is nothing but the Hyde-Porter's disease known as, anthrax, cutaneous anthrax. See, what I've written in the brackets over here is this thing, guys. Basically, coagulase test. Coagulase positive is the confirmation of Staph aureus. It helps us differentiate it from the cons. Remember cons? Coagulase negative staphylococci. It helps us differentiate aureus from coagulase negative staphylococci like epidermidis and saprophyticus, right? Epidermidis and saprophyticus. That is about the aureus. Next is the McFadden's reaction. McFadden's reaction, as you all know, it is done for the capsule of anthrax that is made up of proteins. Polypeptide capsule is present only with anthrax, which is made up of the amino acid D-glutamate. Remaining all capsules, whatever we have studied everywhere, they are made up of sugars called as lipopolysaccharides. LPS. LPS capsules are present in all organisms except anthrax. Now anthrax is special, so it's just given one special test called as McFadden's. Remaining all guys, we will use something called as Quellung's reaction or latex particle agglutination test. Quellung's reaction or latex particle agglutination test. That is about McFadden's. Naegler's reaction is for the toxin of Clostridium perfringens. And lastly, Satylism is with Haemophilus influenzae. Okay, that's about that, guys. Next question. All right, so here we go. Now, the question is saying that a 23-year-old female presents with fever and with the rash on the legs shown in the image. Her BP is less, if you see, 80 over 50. Physical exam showed Brudinsky sign positive. True about the organism causing this condition is. So first of all, guys, certain things as a clinician gives you the diagnosis, they're talking about meningitis here. What tells you this is meningitis? Brudinsky sign positivity, right? This thing is telling us that this is nothing but a case of meningitis. You know, the stiffness in the neck, nuchal rigidity, what you call as. So there are two signs that denotes meningitis. Kernig's sign, another is Brudinsky sign that is mentioned here. Okay, so now another point that you're noticing here is the blood pressure is also quite low. Okay, and then there is a rash. So I've very clearly told you so many times in the classroom, yes, there are so many agents that can cause meningitis. In fact, the most common cause of meningitis is Streptococcus pneumoniae. Please don't think it is Neisseria meningitidis. The most common cause of meningitis is nothing but Streptococcus pneumoniae. All right. Now, but if you see the rash being mentioned, you have to know it is Neisseria meningitidis. All right. This is the characteristic feature you have to remember. If rash is mentioned, then it is Neisseria meningitidis right now. Okay. We have said one more thing happens here, that is hypotension and shock. Hypotension and shock that happens in return because of excessive endotoxin release called as LPS. You all know endotoxin is made up of lipopolysaccharide, and I've told you if lipopolysaccharides are released in excess, they can cause shock as a presentation, right? So because this organism is able to do that, it is going to produce shock, dear friends. Rash and shock, these are characteristics of Neisseria, not with other meningitis. In fact, we have learned one fancy name for the shock also, that presents with shock, bilateral adrenal hemorrhages, etc. It's called by the name of Waterhouse-Friderichsen syndrome. Do you guys remember this point, right? Waterhouse-Friderichsen syndrome. So this is the one that presents with what? Bilateral adrenal hemorrhages as well as the shock what is being mentioned here. So I've described each and everything that you needed to know actually by this guy. Now I'm going to take you to this pure microbiology aspects. First of all, you all know Neisseria genus itself is gram-negative cocci, right? They are diplococci. They exist in pairs. That's why it's called as diplococci, gram-negative diplococci. So that is the word. So if I know it's gram-negative, already I think two options can be ruled out. It cannot be this, it cannot be this. C and D are already ruled out. That means now you're left with option A and option B. All right. Option A says gram-negative, correct. Oxidase positive, that is also correct. Kidney shaped diplococci is wrong. Why? Because if they say kidney shaped, it is nothing but gonorrhea. Gonorrhea is a STD, it's not meningitis. Kidney shaped organisms are gonorrhea. That's why the first option is wrong. Second option is correct. Gram negative diplococci ferments glucose and maltose. That is the confirmation. Biochemical reactions, they ferment glucose and the maltose. So I asked you to do something and remember this, right? So I told you one very important point. The gonorrhea can ferment glucose only, whereas in the meningitis word, you have M also, you have G also. In gonorrhea, you have only G. So you can remember M for maltose fermentation and G for the glucose fermentation. So meningitis can ferment both maltose as well as glucose, whereas gonorrhea can ferment only glucose, right? So that is the idea that you have to have here. Chalo, let us go to the next question. This is easy. I know you guys will do it very easily. True about bacterial vaginosis is, first of all, who's the causative agent of bacterial vaginosis, dear friends? It is this guy by the name of Gardnerella, right? This is the guy by the name of Gardnerella. Gardnerella is the agent that is associated with bacterial vaginosis. You all know there is something called by the name of Amsel's criteria for the diagnosis of this guy. What does the Amsel's criteria say? Right? The pH should become alkaline. It should become more than 4.5. That means this option is wrong. It's saying less than 4.5. This is a wrong option. Okay. The pH should become more towards alkaline side. Clue cells are seen. Yes, they are seen. Right? Clue cells are seen. Is it a odorless discharge? No. When you do something called as whiff test, right? Whiff test by addition of 10% KOH, you get fishy odor. Fishy odor comes. Does it show bipolar stain? No. Bipolar staining is not shown by this guy, right? So that's about that. Basically, clue cells are seen. That is the correct option about bacterial vaginosis over here, right? So please just have a look at this picture. So what you're seeing is this outline. If I draw, this is the normal vaginal epithelial cells. Okay. So these are nothing but the normal vaginal epithelial cells. But now if you see this picture, this is described as the clue cells. So what is the clue cell basically? Apart from the regular cell, which is barely seen over here, there are so many bacteria that are flocking in that area. So these bacteria are seen as that dots over here, right? Is that understood? So that is known as a clue cell, as simple as that. Normal epithelial cell along with the presence of bacteria is just given a name, clue cell. That's all, guys. Okay. You might have learned metronidazole is a drug that is given in this scenario. Chalo, let us move to the next question. Go ahead, please. A patient develops UTI. Lab investigation shows positivity for H2S, hydrogen sulfide, indole as well as urease. That means this guy is positive for H2S, indole as well as urease. Dienes phenomenon is also shown by the organism. Quite simple, so many hints are already given. Identify the organism. All right, my dear friends, let me just mark the correct answer right now. So the correct answer for this is going to be Proteus. Okay. The correct answer for this question is the alpha, that is Proteus. Okay. Why is the answer Proteus here? Why not E. coli, even though that is in the option? I know most of you have chosen E. coli as the answer because you saw the word UTI. Guys, I told you something. Microbiology, you have to read the things carefully, what the hints they are giving you over here, right? Which reaction was it positive with, etc. That is going to make you change your answers, right? If nothing was mentioned, sure, E. coli would have been the answer. But they have said H2S positive. So if you remember on McConkey's agar, we have learned the organisms can be divided into two types, lactose fermenters and lactose non-fermenters. Lactose fermenters and lactose non-fermenters. Next, we have divided the lactose non-fermenters into H2S producing and somebody who don't produce H2S, right? So we have divided them like this, H2S producing and somebody who don't produce the H2S. And somebody who we learned under H2S producing was Salmonella and Proteus. Salmonella and then Proteus. These guys were motile and they used to produce this gas called as H2S, which imparts a black color precipitate. H2S property imparts black color. This is what you have to remember. So out of this option right here, I got my answer as such. Still, I have given you more hints here to come to the correct answer. Guys, didn't I teach you so many times? Urease positive. This guy is urease positive. Because of the urease positivity, it makes your urine alkaline. Alkaline urine is a feature of this agent right now, right? It produces alkaline urine. And what happens because of this alkaline urine? We have learned it tends to form stones. Strew white stones, etc. is a feature of Proteus. All right, so that's about that. Now there are different strains of Proteus like Proteus mirabilis, Proteus vulgaris, etc., etc. Right? So there is one, test over here that is known by the name of Dine's phenomenon. Dine's phenomenon. So Dine's phenomenon is a test to check for the relatedness of species or strains. Relatedness of Proteus strains can be checked by this. Okay? You all remember one thing, right? This guy Proteus produces the swarming motility. We saw, right? This produces that wave-like pattern, etc. That is nothing but the swarming of Proteus. Now imagine, right, there are two related species or strains present in that culture media. If they're related, they will merge together, right? If they're related, they will merge together. See, like-minded people will get along with the like-minded people. If you speak same language, you will get along very easily. If you are speaking different language, maybe there is some issues, right? So generally, the trends I'm telling you. So if there are related strains of Proteus present, the swarming will merge together. If there are different strains present, they don't merge together. That is what we check on the Dine's phenomenon. That is something over here. Another very important thing is Weil-Felix reaction. Make sure you learn that as well. Okay, so that's why the correct answer to this, doctors, is going to be Proteus. All right, next. Here's your next question, Doc Sab. A 35-year-old sexually active man presented with painful grouped vesicular eruptions on penis for 4 days. On taking history, it was revealed that similar lesions had occurred 5 times in last 1 year. Organism associated with such lesion is. Okay, I see the answers coming in. All right. So the correct answer for this is herpes genitalis. So basically, herpes lesion, HSV2. We all know the sexual lesions are more common by HSV2 rather than HSV1, right? Both of them can actually cause sexual lesions, but more commonly it is HSV2, right? So this is what that you have to remember here. The relation, one thing was this guy, once it comes inside our body, we have learned herpes remains latent in our body after that. It remains latent in our body. So this much we know. So I'm just reminding you one thing. If it is remaining latent, it will keep coming back, right? So I told you the word is recurrent. If you get this STD lesions again and again, recurrent. How do I know it is recurrent? The translation is right here. 5 times in last 1 year. What does that mean? It keeps coming back. It's a recurrent lesion. And I told you these are small pimple-like lesions, very, small lesions which are vesicular, right? Vesicular group lesions. They exist in groups like pimples and they are painful. This is herpes. That's all it is, guys. Okay. Nothing much to learn here. This is the basic idea. Now, treponema pallidum. Please remember there are two things that you have to remember. In the primary syphilis, you see the word chancre. Chancre is painless. And in the secondary syphilis, you see this lesions called as condyloma lata, right? In the secondary stage of syphilis, we see condyloma lata. Okay. Next is this Haemophilus ducreyi that causes chancroid, right? This guy causes chancroid. And Chlamydia trachomatis and Neisseria gonorrhoeae, they are known to produce discharge. In fact, trichomonas also I can add in the list. They are going to all produce something called by the name of discharge. Other ones are producing genital ulcers, whereas chlamydia, gonorrhea, trichomonas, they're going to produce some kind of a discharge over here, right? So that brings me here. What we will do is we'll just revise these things once over here. Okay. Now, if you talk about the syphilis, the genital ulcer, what you see physically on the genitalia of the patient, it is painless, as I told you. This is painless and this is single, right? This is going to be single. Now, if you talk about the lymphadenopathy, that is also painless. So syphilis is painless, very simple dude, right? It is painless. Now, generally, when there are some inguinal lymph nodes, when they swell together, when they become, swollen up, there is a word used as bubo. So bubo is not seen with syphilis. So basically, basically the lymph node involvement is not much here. It's a ulcer that is also painless. So syphilis is simple. I call it simple syphilis, painless. End of the story. Okay. Now coming to the next dude called as chancroid. Chancroid is caused by ducreyi. I always told you how to remember it. Patients do cry, right? Ducreyi, patients do cry. So why do they cry? Because it is painful. So this is the lesion we know. And now from single we are progressing. It could be single or it could be multiple also. Now if you talk about this guy, it is painful here also. It is making you cry. So it's painful here also. Lymphadenopathy also is painful. And yes, you will see something called as bubo formation now. This is an important thing. Bubo formation would be seen with chancroid. Okay, this would be seen in the chancroid. Next, if you talk about donovanosis, what you have to remember is donovanosis is caused by Klebsiella granulomatis, right? This is also painless lesion. Lymphadenopathy is absent in this dude. LGV, right? It is painless and it is this lymphadenopathy is absent in this. But what you can see is there might be some subcutaneous nodules. Please understand, I'm not saying this lymph node swelling. I repeat my words, right? Lymph node swelling, I'm not saying that. I'm saying subcutaneous nodules are there, which gives it some swelling appearance. That's why we call it as pseudobubo, right? Pseudobubo. Why is this name given over here is it's not the lymph node swelling here. It's not a true bubo. It is basically subcutaneous nodules. It's subcutaneous nodules that are swelling up. That's why they make it look like a bubo, right? So that is the word. Next, LGV, lymphogranuloma venerum. It is by Chlamydia trachomatis, the serotypes L1 to L3, L1 to L3, and this is also painless. See guys, there are two lesions that are painful that you should know. Your exam mostly will ask you questions from genital ulcers. I doubt they will go into lymphadenopathy mostly, right? So just keep in mind at least the basic points what I'm telling you. Who are the painful lesions? Only chancroid, it makes you cry, remember, do cry, and herpes. These are the painful. Remaining everybody is painless. That too single multiple also, that doesn't matter much. So at least remember who is painful, who is painless. Who is painful? Highlighting that chancroid and herpes. Right? End of the story. Next, coming to the last points here, in the LGV, this is going to be painful. The lymphadenopathy is painful, and here also you see bubo formation. So true bubo formation is basically seen with LGV and chancroid. It's seen with LGV and the chancroid. And in fact, in LGV, I'm sure you studied this, the femoral lymph node and the inguinal lymph nodes get swollen up like this, and there is one, gap created in between. It's like a valley. This is described as the groove sign, right? Grooves sign is a feature of LGV. LGV. So what exactly is that groove sign? Between femoral and the inguinal lymph nodes, you are seeing some gap like this, described like a groove. And finally, to end this is going to be painful again. Herpes is everything painful, and no bubo. Okay, no bubo. So chalo, let me make it simple. What are the things that you should remember here, doctors? Okay. See, who's the simple guy here? Syphilis. Simple syphilis. Simple syphilis. Why am I saying simple syphilis? It's not painful. Painless, painless. Done. Who are the painful guys here? See, painful, painful. Herpes and chancroid, everything is painful. End of the story, right? Everything is painful with chancroid as well as herpes. Bubo, ab bach gaya bubo. Who's the only one having that bubo formation? It is chancroid and LGV. LGV mein to you have to know that. Why? Because there is something that comes because of the swelling called as the groove sign, right? So this was just, a brief insight on the different things that you see with the STDs. We are not getting into the discharges or anything right now. I just told you about the genital ulcers and the, related lymphadenopathy that we can expect here. Why? Because STD pe there is one question that will come. You call it microbiology, PSM, dermatology, I don't care. As long as you guys score, I will be happy. So that's why I just tried to revise this for you once over here. Okay, so that's it, guys. This is about that. Okay. Dr. Shrishti, this is going to be painless. LGV is painless, right? So genital ulcers are basically painless in LGV. They barely complain of anything over there, right? Symptoms are quite minimal. Alrighty. Next, let us move to this question. What is true about the nucleic acid of the virus shown in the image? All right, shown in the image. Let me give you a hint. You have to think between the shapes of viruses that we have learned. 6 to 7 shapes maximum we might have learned. You have to relate who does it look like from that topic. First, identify that. If you know, then this becomes easier. All right, guys. So let us go ahead right now. This is described as wheel-shaped virus. Okay, this is described as basically wheel-shaped virus. It looks like that. Who is wheel-shaped virus? Rotavirus. Basically, they are describing who over here. It is rotavirus. And you all may remember rotavirus is a little exceptional. I'll just remind you one thing. All the DNA viruses are double-stranded. Logical, right? DNA is double-stranded. So all DNA viruses are double-stranded except parvovirus. Parvovirus is a single-stranded DNA virus. The description ssDNA is nothing but parvovirus. Exactly like that, all the RNA viruses are single-stranded, right? RNA is supposed to be single-stranded, so all the RNA viruses are single-stranded except reoviruses. Reoviruses are double-stranded RNA virus, and this guy is a member of reovirus family. We have written that there only, right? Reovirus example is rotavirus. So rotavirus is a double-stranded RNA virus. So correct option for this, doctors, it is going to be double-stranded RNA. It's an exceptional virus, rotavirus. Okay, it causes diarrhea, doctors. It is the most common cause of diarrhea in children. Rotavirus is the most common cause of diarrhea in children. Is that understood by all of you? So this is the thing that you have to remember. Okay. Now, next, let us go to the next question here. All right, so Epstein-Barr virus. Epstein-Barr virus causes all except, right? So you should all first of all remember Epstein-Barr virus, it affects the B cells. That is the target, right? It binds to the CD21 or CR2 receptor that is present on the B cells. This is what we know. EBV, we remember it like this. Now, what is the general disease caused by this agent? Infectious mononucleosis, also called as Kissing's disease, right? It spreads through the saliva, right? So this is known as Kissing's disease, infectious mononucleosis. But this infectious mononucleosis can actually be caused by two viruses, namely Epstein-Barr virus and cytomegalovirus. Both of them can do that. And to know who is causing this disease, we have learnt one test by the name of Paul Bunnell test. Paul Bunnell test, which is an example of heterophile tests, right? Paul Bunnell test, which comes under examples of heterophile test. So if you get the result as positive, it is considered to be Epstein-Barr virus. If you get the result to be negative, then it's considered to be cytomegalovirus, right? You all remember that? Infectious mononucleosis or Kissing's disease is by both EBV as well as CMV. That's why to differentiate them only, there is a test called as Paul Bunnell test. Now, look what the question asked you. They asked, what are the diseases caused by EBV except, right? Basically, which diseases not caused by EBV? Probably all of you answered this correctly. This is nothing but Kaposi sarcoma, right? Kaposi sarcoma, this is caused by another herpes virus called as 8. And this one happens in HIV patients. I told you this is a thing that we see in AIDS patients, Kaposi's sarcoma. Other things, Burkitt's lymphoma, Hodgkin's lymphoma, non-Hodgkin's lymphoma, nasopharyngeal carcinoma, all these things, Duncan's disease, oral hairy leukoplakia, these are all conditions caused by Epstein-Barr virus. Okay, so that's it, guys. Nothing much to discuss in this dude now, right? This is HHV4. The number 4 is called as Epstein-Barr virus. Next one, dear friends. All right, so let us talk about this one now. So guys, this guy is asking you first of all to identify what is this lesion, which is quite easy, and I know most of you have already done it. Okay, this is the thing that you have to do. Next, this is nothing but molluscum contagiosum, a type of a pox virus, right? Molluscum contagiosum, it's a type of pox virus. And you know, how do you recognize this? You see this central depression like this in this. This is described as crater-like lesions or umbilicated lesions. Crater-like lesions or umbilicated lesions. This is the word that you all should be remembering. Once you got this idea, right? What bodies are found to diagnose this? You all know they are called as HP bodies, Henderson-Patterson bodies, also called as molluscum bodies. Molluscum bodies. That is the one which is the correct answer for this, right? But let us look at the other options also. Negri bodies. Negri bodies are a feature of rabies, right? Negri bodies are very important in the diagnosis of rabies. Tories and the Lipschultz bodies, these are types of Cowdery type A bodies. These are types of Cowdery type A bodies. There are two names, Tories and the Lipschultz, right? Tories bodies are seen in yellow fever, which is not seen in India. Yellow fever is not seen in India, right? So Tories bodies are seen in that. Lipschultz bodies are a feature of herpes. These are seen in herpes. All right, is that understood by all of you? So Lipschultz bodies and this one, basically, they're seen in the herpes simplex virus, right? So that's about that. Quite an easy question. Chalo, this is also easy. Let us finish this quickly. This entire question is just revising one concept in this that you should be knowing already. All right. The question is about dengue fever. Now, there is something that we have learned with dengue fever. There are different types of the serotypes that we see in dengue fever, but the type 2 is considered to be the most dangerous out of all, right? The type 2 is considered to be the most dangerous out of all. Now, especially if you previously were infected with dengue serotype 1, followed by the dengue fever virus 2, this is considered to be a deadly combination, right? This is considered to be a very dangerous combination. So guys, understand what I'm trying to tell you here. Something paradoxical is happening here. See, when you get infected by the den1, some antibodies might have been formed, right? Some antibodies might have formed in your body, right? So all I'm saying right now is this thing, some antibodies might have formed against the den1 virus. Now, this may happen years later, months later, whatever it is. Suppose whenever you got infected by the second serotype now, right? You got infected by second serotype. So what is going to happen when you get affected with second serotype? These antibodies, right? These antibodies, instead of going and fighting the second virus, they are actually protecting the second virus, right? These guys are actually protecting the second virus. Is that understood by all of you? So this is basically the concept, and this is known as ADE, which stands for antibody dependent enhancement. That means it's our antibodies which is enhancing the infection. They're giving this guy chance to cause actually more severe disease in our body, right? So that's about that. So you guys got this idea? Now, let us learn something next over here. So what is going to happen when you get a severe presentation of this? You get this diseases called as dengue hemorrhagic fever and dengue shock syndrome, right? There is increased chance of dengue hemorrhagic fever and dengue shock syndrome. So this is the idea that you should all have as such over here. Okay. Now, there is something else that I would like you guys to learn here. Okay. This is more of a clinical question. Now, what you're looking at right now, this is described as tourniquet test. Okay, this is described as something known as what? This is described as tourniquet test. All right. Now, what we are doing in the tourniquet test is, let's say you're taking the vitals of the patient. The blood pressure may have come something. Okay, let's say the blood pressure may come something over here, that is 100/70. Just for the example we are taking here, if the blood pressure has come 100/70 in this patient. All right. So now what you're going to do is, once you have taken this blood pressure, okay, note this value, what has come, 100/70. And now what you should do next is add up these two values. 100 plus 100 plus 70 becomes how much? 170, and divided by 2. Divided by 2. And this is the value that you are going to get now. That means 85. So what I'm saying is, once you got some value in the patient, right, add up those two values, systolic as well as diastolic, and then what you should do is add up both systolic diastolic divided by 2, get this value right now. Now again tie the blood pressure cuff and inflate until this value called as 85, right? Inflate until 85. And then what you should do, hold there for 2 to 5 minutes. Hold at that point for 2 to 5 minutes and then deflate after that. So what you're going to see is this PTK that are going to form. If you see more than 20 PTK per square inch, this is suggestive of dengue fever. This is a clinical test called by the name of tourniquet test. What we are doing is, we are just using the blood pressure cuff as a tourniquet, ghiti jo bolte hai, right, which is going to create a pressure here. And how do you inflate, at what value, etc.? I told you, just measure a normal BP. If it is 120/80, total becomes 200. What is the half of 200? 100, right? Simply 100 would be the half of that. Inflate until 100, hold there for 2 to 5 minutes and then deflate. You will be seeing formation of PTK. If there are a lot in number, more than 20 per square inch, then we are going to say the person may have, dengue fever, right? So that's about that. Next. This is quite a routine question that we all know about, right? So hopefully none of you will make a mistake. Everybody get this correct. All right. So guys, let us answer this one. A nurse who recently had a needle stick injury, a very common thing in doctors, got a blood work done out of concern, right? So report showed HBS antigen positive in her. HBE antigen also is positive and IgG anti-HBC is positive. What is the interpretation according to the investigations, right? What is the interpretation according to the investigations? All right. Now, the point is, if she is already having IgG, whatever it is, see, recently she might have got, injured, but maybe she got injured before also. Needle prick injury might have happened before. So I am going to trust the report, not what she's saying that she got recently, injured or whatever it is, I'm going to see the report. If HBS antigen is positive, you all know, we conclude the person is having what disease? The patient is having hepatitis B. If you see this antigen positive, we say the person is having hepatitis B. Next point is, if this antigen HBE is positive, then you will say the person is highly infectious also. So high infectivity is present. Now in this female, both the antigens are present. That means she is a case of hepatitis with high infectivity, as well as IgG was seen. That means chronic case of hepatitis. So what is this correct answer to this? It is a case of chronic infection of hepatitis B with high infectivity, right? With high infectivity. This is quite a easy question. So repeat type of a question. Make sure you guys all know this. The only people in which you see the anti-HBs becoming positive, anti-HBs becoming positive is one person who is a vaccinated case of hepatitis B, another who recovered from this infection, also called as past infection. So if somebody had this infection in the past, that is this idea. Okay. So anti-HBs is present only in two people, vaccinated and this. If only anti-HBs is present, it's a vaccinated case. That means only one single antibody is present, it's a vaccinated case. If more than one antibody is present, if there is more than one antibody present, then that is a recovered or past infection. So you will form antibodies towards pretty much all antigens of hepatitis B. That's why it's called as a recovered or a past infection, right? So that's it, guys. Now, please see this question. Most sensitive test for HIV infection. This is a straightforward one-liner I'm asking you right now. Most sensitive test for HIV infection. So take your time, quickly answer this, guys. Most sensitive test for HIV infection is? The correct answer to this is ELISA, as you may all know about this. Okay, so the most sensitive test for this is known as ELISA, right? The correct answer to this is going to be ELISA right now. Okay. Now, next thing, in India, the Western blot is taken as a confirmatory test, right? Please remember, this would be taken as the confirmatory tests over here. Next, going to some important points that we should remember from this. Please notice what I'm going to tell you here. Okay. The points that you have to remember is this. This is one graph we are all familiar with, but still we are just going to discuss this once again. All right, let us assume at this point somebody was exposed to HIV. That means this is someday the person was exposed to HIV. This is the point of exposure to HIV. Now there are things that you should remember here, right? The point being that anything earliest that I can detect over here, this is going to be by day 12. Okay, the earliest I can detect anything, it is going to be by day 12. And by day 12, I will be able to detect the patient's HIV RNA. That means from the patient's body, I will be able to detect what? HIV RNA. And you know, how do you detect this RNA, DNA, etc. in viruses? You detect it by something called as PCR, which comes again under the techniques called as NATs. nucleic acid amplification test, right? Nucleic acid amplification test. That means this is the thing which tells us earliest, right, if somebody has contracted HIV or no, right? This is the first point. Now, the next thing that can be detectable, it is something by the name of PCR, P24 antigen. So next thing is P24 antigen. This can be detected, and ELISA, called as fourth generation, can detect this P24 antigen. Okay, ELISA, that is the fourth generation, can detect this P24 antigen. That is about this test. Another thing is, after this much time, now you will see the rise of antibodies, right? This happens at least after 3 weeks or so. Okay, 3 to 8 weeks it takes for the antibodies to form. That means the least earliest expected would be 3 weeks. It's not necessary it would be seen in everybody also. Are you understanding? Antibodies are going to take time to come. That you should keep an idea. Antibody against the HIV takes time to come. The minimum, the earliest we can expect is around 3 weeks, but it may go until 8 weeks, 10 weeks also sometimes. And this period from here to here until the formation of antibodies, this is called as window period. This is known as window period. Window period is that time until the formation of this antibodies. So now, if I ask you what can be done in the diagnosis during the window period, of course, you will say the answer as HIV RNA and P24 antigen. These are the things that you can detect, yes or no, right? The two things that you can do before the antibodies have formed, of course, it's going to be either HIV RNA or the P24. PCR is a gold standard. It is the best thing, right? I won't disagree with that. Best thing for window period also is going to be this thing, that is HIV RNA. This is the best thing we can do to detect the HIV during window period. But more commonly, P24 antigen test is done, right? So more commonly P24 antigen test is done. So that is the idea that you should have. The best test available is PCR, but P24 antigen is the one that we commonly do. And the good thing about this ELISA, let's say if antibodies have also developed, the same test ELISA 4th generation can detect antibodies as well as antigens. Both things can be detected by ELISA. And in fact, it is the most sensitive test also. ELISA is the most sensitive. And somewhere around a month later, you will see, this thing, Western blot can be done, right? So Western blot, this is the confirmation that is done in India according to the NACO guidelines. National AIDS Control Organization, according to the guidelines, right? Western blot should be taken as the confirmatory test. So keep this in mind, please. Whatever I told you right now, this should be very clear. All right. So generally, when they use the words like recent history of exposure, window period, etc., mostly they're looking for the P24 antigen as the answer. Okay, that is what they expect from you guys. All right. But if they change the wording and ask you what is the best test during that time, please answer PCR, NAT or PCR. Here you go, next question, guys. All right, doctors. So this is like a giveaway. They have said the patient is having fear drinking water. If they're describing somebody having fear drinking water, it's called as hydrophobia. And hydrophobia is a classical feature of the disease called as rabies, right? Classical feature of the disease called as rabies. So rabies, virus, it has two main antigens, one called as glycoprotein G, which helps in causing the disease. Disease causing antigen is glycoprotein G. Another is known by the name of nucleoprotein. Another is known by the name of nucleoprotein. So as you see, nucleoprotein is mentioned in the list here. So this is the one that we use in the diagnosis. All right. So what is the test that detects this? The name of the test that detects this nucleoprotein, it's called by the name of DFAT. Direct fluorescent antigen test. DFAT is direct fluorescent antigen test. This is the test that can detect the antigen, because it's clearly telling you if in the name itself, I'm an antigen test. I detect antigen. So which is the antigen it's detecting? Nucleoprotein, right? So the test that we can do for the rabies right now, they are DFAT and the PCR. You know where to take the sample from, right? You have to take the sample from the back side of the neck, called as nape of neck, hair follicle from the nape of neck, or even corneal smears can be used as samples, right? So that is the testing that we do in the antemortem, right? If somebody is dead, the postmortem diagnosis is done by finding out these bodies called as Negri bodies. Negri bodies are a diagnosis of postmortem. All right. Why? Because they're found in the CNS, right? Hippocampus, cerebellum, brainstem. These are the places where you can expect the Negri bodies. All right, guys. That's about that. Look at the other antigens just to rule them out. Hemagglutinin and neuraminidase. These are nothing but the antigens of influenza virus that causes flu. So, for example, H1N1, H5N1, these numbers, swine flu, bird flu, these H and N stand for hemagglutinin and the neuraminidase. So they are not from this virus, obviously, they are from the influenza virus. And GP120 is the antigen of HIV virus, right? So the correct answer to this is going to be nucleoprotein. And guys, by the way, rabies topic is again quite a frequently tested topic. You should definitely revise the entire things what we studied in the classroom, right? So that's about that. Next. All are true related to epidermophyton except. All are true related to epidermophyton except. This is the first thing that you have to understand. Who are we talking about here? Let me give you a hint in case. I know you guys are doing well, you will answer this also, but just for the sake, I want to give you one hint. We are talking about these fungi, what we call as dermatophytes. Tinea infections, dermatophytes mein, there were three types we had studied. So this is one of the three types you all know about. Epidermophyton. So they are asking what is wrong about dermatophytes or this epidermophyton. Basically, epidermophyton is a type of dermatophyte infection. It's not a candida infection, right? So right away you can rule out even if you don't remember all the other points. So it's a type of dermatophytic infection. The dermatophytic infections are also called as tinea, or they are also called as ringworm infections, as you all know, right? So these are the words. Dermatophytes are also called as tinea or the ringworm infections. So this is the right key point that you should all remember right here. Okay, so dermatophytes or tinea or ringworm infections. So this is the idea here. The correct answer was that. Now what I'm going to do is I'm just going to explain these things one by one to all of you guys. So first of all, let us see this. This is a picture of trichophyton. So what is about trichophyton? Trichophyton has the word tri. It means it involves hair, skin, and nails. All the three things are involved by trichophyton: hair, skin, and nails. That is trichophyton. Okay. Next, we all know to differentiate between trichophyton, epidermophyton, and microsporum, there are things we have to look for what are known as macroconidia and microconidia. macroconidia and microconidia. Macro means big. Because they're big, you can appreciate their shape, right? We can remember it like that. Here, the macroconidia are described as pencil shaped. So if you look here very clearly, you can see it looks like a pencil, right? These guys are described to be like pencil shape. And these round things, what you're seeing here, they are nothing but the microconidae. And you can see they are quite abundant in numbers. There are so many microconidae that you are able to see, abundant in number. Is that clear to all of you? So this is a picture of what? Trichophyton, pencil shaped macroconidae and abundant of this microconidae. That is the first point. Okay. Next, let us move to this guy, the second picture. The second picture is describing somebody called as epidermophyton, on which the question was just now. Epidermophyton, remember it like epiderm layer, epiderm like the outermost. We are going to remember it like skin and nail. Skin and nail is involved by the epidermophyton. Same story. Let's look here. Macroconidae and microconidae, the same two words. But notice something, you're not seeing any of those, dotted things here. That means microconidae are completely absent in epidermophyton. They are completely absent in epidermophyton. And how are these guys described as? They are described to be club shaped, right? So this shape, what you're seeing here, generally it is described as the club shaped. All right. See, the previous one was pencil shaped. They were quite slender. This one is described as the club shaped. And microconidae are completely absent in epidermophyton. And last and the final, the microsporum, right? The last and the final in this list, it is nothing but microsporum. The microsporum involves skin and hair, right? The combination is it involves skin and hair. As usual, macroconidia and microconidia. These we have to discuss. The macroconidia, if you look at the shape here, this is described as spindle or boat shaped. They look like boats, right? Spindle or boat shaped in microconidia. Macroconidia. Microconidia are also there, but they are few in number, right? Now, let us just quickly revise once again. Trichophyton, right? This is the guy that has maximum tissue involvement and it has maximum microconidia. Let us remember it like this. Trichophyton, it has maximum tissue involvement, hair, skin and nail, and then it has maximum microconidia also. Okay, how about this guy? Look, microsporum, micro means less or few. So you can remember few over here. Microconidia are few. You can see very few are seen over here. And shape is spindle or boat shape. And epidermophyton, this guy called as microconidia are completely absent. They are completely absent here. So that's about the point here. Okay. So this was just a quick recap of the tinea infections. Very, very important points. Come on, give me the answer very quickly here, Dr. Saab. Amazing. You guys are doing very well, very well. Okay. So this is nothing but sporotrichosis, as you are seeing the ulceration along the line of lymphatics, right? This is nothing but sporotrichosis. Very easily you can identify, right? Now, the idea is, how do you recognize this is by this bodies called as asteroid bodies. Okay, that is the correct answer to this. Now what I will do is quickly I'll just make you guys revise the dimorphic fungi right here. So guys, first of all, what you see on the left side over here, these are nothing but the mold forms. Dimorphic means they will exist in two forms. One is mold, another is yeast. See, yeast is in our body, that is at 37 degrees. At 37 degrees, they are in our body, right? This is the form on the right side, what you're seeing. And then the mold forms, they exist like that at 25 degrees. Molds are nothing but the hyphal forms. So all of them, they are going to appear as septate hyphae. All of these guys, they appear to have something called as septate hyphae. Is that understood by all of you? So molds are nothing but the hyphal forms. So these guys, dimorphic, they exist in two forms based on the temperature. This much we know. All right. So let us talk about this one by one. Let us first finish the yeast forms. So the first one, what you're seeing is the broad-based bud. Broad-based bud, it is a feature of blastomyces, right? It's a feature of blastomyces. All right, so that is the thing. Broad-based bud is a feature of blastomyces. So this first fungus that is written here, it's nothing but the blastomyces. Blastomyces, one yeast form, and the mold form is shown here. Now, these thing what you're seeing, they are nothing but the hyphae. The lines in between, they are the hyphae. And then these things around them, they are called as conidia. So you see this conidia, the round ones, they are called as conidia. Nothing specific, that is a less likely question. If they ask you a question on blastomyces, it is going to be broad-based bud, which you all know about. Okay? Next, the next in the list is this agent called as, coccidiomycosis. Coccidiomycosis. And please remember, coccidiomycosis, I've already told you, it's a spherule. Spherule means something round, sphere, filled with endospores. You see the spores are filled in there. So spherule filled with endospores, it's a characteristic of coccidiomycosis. All right. And now if they ask you what is the mold described as, this mold is described to have this barrel-shaped arthroconidiae. Barrel-shaped arthroconidiae. So these are all conidiae we are discussing. So they're just described to have one shape called as barrel-shaped. Barrel-shaped arthroconidiae are a feature of coccidiomycosis. Next, doctors, it is nothing but histoplasmosis. Histoplasmosis. Histoplasmosis has nothing special as such here. It's a narrow-based budding, but this narrow-based budding is seen inside macrophages. Inside the macrophages, reticular endothelial cells, you will be seeing the narrow-based budding of this fungus. All right, and if you see the mold form is described to have tuberculate, okay, tuberculate conidia, right? Tuberculate conidia. So these are all conidia only that you are looking at. This shape is described to be tuberculate conidia. This is the feature of histoplasma. Next, the yeast form of the next agent, I'm sure you will recognize. It is nothing but paracoccidiomycosis. Paracoccidiomycosis. Next one. How do you recognize this? These shapes, what you're looking at, described as captain wheel, or Mickey Mouse appearance. Captain wheel or the Mickey Mouse appearance, paracoccidiomycosis. And if you look at the mold forms are described to have this teardrop shape. Okay, the conidia here, they are described to be like teardrop. They look like that. And lastly, another important dimorphic is nothing but sporothrix. Sporothrix, the one that causes rose gardener's disease. These yeast forms are described like cigar bundle shape. This is the feature of this guy. Okay, cigar bundle shape is with sporotrichosis. And then if you look at the conidiae, they look like flower. So I ask you to remember people like this. We are talking rose gardener's disease. Even the conidia look like flowers or roses. Let's remember them like that. When we talk about captain wheel, it's the ship's wheel, right? It looks like the ship's wheel. And I think we all can relate. One movie we all remember with the ship is Titanic. Titanic was a sad movie. We all have cried at the end. So we will remember the teardrop with this. Okay. Now in histoplasma, tuberculate has become something special. Narrow based budding is normal. Whereas in the blastomyces, the conidia are normal, but the yeast form is special, broad based bud. And finally, the coccidiomycosis, spherule is having endospores, and barrel shaped arthroconidia are seen with this guy, right? So this is the detailed revision of, basically your appearances in the dimorphic fungi. Okay, so that's about that, guys. Pretty much the end of this dimorphics. So we are pretty much coming to the end. So I want you to be a little quicker. Go ahead. Let's not spend too much time also. We should get done as soon as possible from now. All right. So here's our next question. A patient presented to the ENT clinic with complaints of pain, itchiness, and discharge from the ear, right? Diagnosis of otitis externa, right? Something called as swimmer's ear, right? The common name is swimmer's ear was made. Culture of the organism showed black colonies. Now, just because you read the black colonies, I really hope you don't choose mucor or rhizopus. All right. Who is one of the most common agents of otitis externa? The answer is Aspergillus niger. Aspergillus niger. That means option A and option D is incorrect. They are gone out of this. So you're left only with Aspergillus and the option B and option C. So what is the correct answer? Acute angle branching. You all know, right? Acute angle branching. The difference between Aspergillus and mucor is this. Aspergillus branching is 45 degrees, known as acute branching, and it will have septate hyphae, whereas mucor will have around 120 degree branching angle. This is 90 to 120 degree branching, known as right angle. And guys, this is aseptate hyphae in the mucor. So we have learned, right, quite in detail in the classroom. Mucor has aseptate hyphae, aseptate hyphae. So this is all that you need to know in this topic. Next question is this. Please quickly go over this one. All right, everybody. Now the next question is saying that mechanism of action of cholera toxin is cholera toxin. So first of all, remember cholera toxin produces rice watery stools. That means watery diarrhea they're asking you. Watery diarrhea, please remember it's due to increase in cyclic AMP. In fact, another guy that works by the same toxin, cyclic AMP, is ETEC, enterotoxogenic E. coli. T40, we all know it to cause something known as traveler's diarrhea. The most common cause of traveler's diarrhea is ETEC, which also works by increasing cyclic AMP, and it causes watery diarrhea only, traveler's diarrhea also. Neurotoxins are tetany and botulinum. One causes contractions, one causes relaxations, that is tetany versus Botox. The one that interferes with the 60S ribosome is Shiga toxin and Shiga-like toxin. And the one with elongation factor, the one that blocks the protein. They both block protein synthesis, guys. They both block protein synthesis, but the mechanism how they block protein synthesis is different. So the one with elongation factor is diphtheria and pseudomonas. Diphtheria and the pseudomonas, right? So that's about that. This is a question that is again expected, guys. Mechanism of toxins is an important topic. Okay, chalo, let us finish this. Quite an easy one. Ye to you all should answer this. Please participate. Antibody with the longest half-life. Antibody with the longest half-life is. Okay, so the antibody with the longest half-life, it's a very easy question. You all should remember the answer to this is IgG. IgG has three things in which it's highest. Daily production, this is the highest produced antibody. Daily produced antibody, maximum amounts is IgG. Half-life, that is the longest life, right? This is again maximum with IgG. And the third thing is serum concentration. Serum concentration also is the highest with IgG. Now, for all the three properties, the least is IgE. Highest is IgG, the least is IgE. And antibodies, definitely one question more or less comes up from this, either from the structure or the properties. Just as one extra edge, please tell me this. You all remember pentameric structure. Pentameric structure is IgM. That's why it is the largest antibody. Is joined by J chain here. And this is dimer. IgA is the dimer, right? So it has 4 binding sites. Valency is 4 for IgA. And this one has 10 binding sites. So the valency for IgM is 10. So IgM and IgA, these are the ones that are existing in multiples. Remaining all antibodies exist as a single antibody. They all exist as a single antibody. All right, that's about that, guys. Chalo, next one you have is pernicious anemia is an example of. Pernicious anemia is an example of. So you should all remember anything to do with blood, more or less the correct answer would be type 2 hypersensitivity. Pernicious anemia, it is type 2 hypersensitivity. Generally, the blood examples are example of type 2. Now, this disease also, pernicious anemia, comes, under type 2. So, you have to remember it like this. My blood group, okay, my blood group is RH positive. Okay, my blood group is RH positive. This is one mnemonic to remember this. With the my word, you have myasthenia gravis. My for myasthenia gravis, it's an example of type 2. Blood related anything is type 2. The group G stands for Graves' disease. Graves' disease. I for ITP, immune thrombocytopenic purpura. Thrombocytopenia means blood related. Again, it has to come under type 2. Next is RH for rheumatic fever. RH for rheumatic fever. And the word positive, if you want to say the word positive, this is pernicious anemia. Okay, this is going to be pernicious anemia. This is nothing but examples of type 2. Allergies, etc., come under the examples of type 1, right, doctors? So that's about that. Next, let us just have a look at this thing. Okay, so here you go. This is our last question. Basically, what we have solved. Please remember there are four main types of hypersensitivities, and the first three are described to be humoral antibodies. I mean, humoral immune response, right? The first three is humoral, and the fourth one and the final one is described as CMI, cell mediated immunity. The last one is described as the cell mediated immunity. So this is the word that you should all remember, doctors. So fourth one is different. So cell mediated immunity, who is the cell who is going to do the damage in this hypersensitivity? It is described as TDTH. It's a type of T cell. DTH stands for delayed type hypersensitivity cell. It's a type of a cell, right? TDTH. This is the final mediator that is going to cause the damage. It recruits some cells called as macrophages, basically, which is going to do the damage here. Okay. Now, coming to antibodies in type 1, you all know IgE is involved here. IgE is involved. In type 2, it is IgG. In type 3 also IgG. But more important word in type 3 is immune complexes, right? It is basically the immune complexes. This is the main word. And you know this mnemonic acid that goes for that. What does the word acid tells you? This is allergies, okay, cytotoxicity, immune complex, and finally delayed type of hypersensitivity. Finally, you have the delayed type of hypersensitivity. So these are the four words. Finally, just looking at the onsets, right? Let us remember the onsets. When does these symptoms present after you're exposed to these allergen? As you go down in the hypersensitivity, the time for the onset increases. So the first one happened minutes after exposure to allergen. The second and third happens few hours after the exposure to allergen, and fourth one happen after days. 2 to 3 days later, you will get the symptom. That's why the name is delayed type of hypersensitivity. All right, that's why the name here is delayed type of hypersensitivity. All right, so I hope you guys got this idea. This was just a quick recap of the hypersensitivities, etc., which are again quite an important topic as such for exam. Again, just a quick reminder to all of you, make sure you look at the other video of the 25 important questions. That and this one can give you a lot of insight towards the most important topics. All right, so that's it from me, guys. This was the discussion of the most important questions. I really hope this session helps you revise a lot of things and makes you understand the emphasis on certain topics which are frequently tested in examination. All right, you guys did quite well on the answering part. All right, thank you for all the participation, and I wish bestest of the best luck to all of you, and my prayers and the best wishes with you guys that you guys pass this exam in this very attempt. All right, so thank you very much for holding on. I will hear your good news. Probably you will send me a text, sir, I have passed this exam. That's what I'm waiting to hear from you guys. All right, thank you very much. One last time, all the best.